Hey there, curious minds and pet parents. Have you ever caught a glimpse of something? Well, unexpected. Maybe in your pet's bedding or their litter box.
That little flicker of movement?
Yeah, and wondered, what is that? Maybe it looked like a tiny grain of rice that suddenly moved? Well, you're definitely not alone.
Happens all the time.
So today we're taking a deep dive into the surprisingly common, if maybe slightly unsettling, world of pet tapeworms. Understanding, treatment, and prevention.
Yeah, let's unpack this.
Our mission really is to cut through the complexity, give you a shortcut to being truly well-informed. Keep those furry friends happy, healthy, and free of these, uninvited guests.
And that's exactly what this deep dive is all about. Tapeworms are a fact of life for lots of pet owners, but often the understanding kind of stops at, it's a worm.
Right, just sort of a general idea.
You want to go beyond that, give you the critical knowledge to not just recognize them, but effectively prevent and treat these parasites without getting bogged down in tons of overwhelming detail.
Perfect, just what we need.
It's about arming you with practical, essential insights.
Okay, so let's start with the basics then. What are we actually talking about here? When I picture tapeworms, I think of something long and, tape-like, obviously. Can you paint a clearer picture for us?
You're actually pretty close with that image. Picture a flat, segmented ribbon, or like you said before, maybe like a tiny living pasta noodle.
Huh, okay.
That's decided to take up residence inside your pet's intestines. They literally latch onto the intestinal wall and basically siphon off nutrients from your pet's food.
They're mooching.
Pretty much. They're called tapeworms because of that really distinctive, long, flat shape.
So yeah, definitely not a welcome roommate. And I remember you mentioning their structure is kind of unique. What's special about how they're built?
Indeed. What's truly remarkable, and maybe a bit unnerving, is how they're actually structured. They're made up of many small segments called proglottids.
Proglottids, got it.
And each one of these segments is essentially a tiny, self-contained reproductive machine just packed with eggs. When they mature, these segments break off and are passed in your pet's feces, ready to, continue the cycle.
Talk about efficient biology. Now, when we talk tapeworms in pets, are we just dealing with one kind? Or are there different types we should know about?
That's a great question, actually, because it directly impacts how we prevent and treat them.
Yeah.
The vast majority, really most cases we see in dogs and cats, are caused by Diploidium caninum.
Diploidium. Okay.
That's the one most pet owners are going to encounter. But you're right, there are others. We see species like Taenia and Echinococcus too.
And they come from different places.
Yeah, different origins, often linked to pets hunting and maybe consuming infected rodents or rabbits. So while our focus today will mostly be on Diploidium just because it's so common,
right?
The core principles of prevention we talk about often have broader applications. It's good general practice.
That makes perfect sense. So we know what they are. Now, the big question for so many pet owners, how on earth do these things actually get inside our pets? Is it just from, rooting around outside?
Well, this is where we get to one of the most surprising and honestly crucial aha moments of this whole topic.
Oh!
For Diploidium caninum, that really common tapeworm, it's not just about being outside. It's almost entirely about fleas.
Fleas! Seriously? You're kidding.
Nope, not kidding.
So those annoying little itchy things are actually acting as some kind of delivery service for internal parasites. That's a truly unwelcome thought.
Exactly. Think of fleas as the unwilling Uber drivers for these tapeworms. They are the absolute critical link in the chain for Diploidium. It's a fascinating, if pretty gross life cycle when you look at it.
Okay, my curiosity is definitely piqued now. Walk us through this surprising journey. How does a flea end up being a tapeworm taxi?
Right, so it all starts with an infected pet, a dog or cat that already has tapeworms.
Okay.
Remember those rice-like segments we talked about, the proglottids? Well, they detach and are shed in the pet's poop. These segments are just loaded with microscopic tapeworm eggs. Now, here's the key bit. Flea larvae, which live in the environment, think carpets, pet bedding, that sort of thing.
Right, not usually on the pet yet.
Exactly. They're basically tiny detritus eaters. They munch on organic material around them, and sometimes, completely accidentally, they ingest these tapeworm egg packets.
Oh, okay. So the flea larvae are eating tapeworm eggs, and then what happens?
Precisely. Once that egg packet is inside the flea larva, the tapeworm egg hatches. It develops into an immature form called a cysticercoid.
Cysticercoid, okay.
And this little cysticercoid then matures right alongside the flea itself, as the flea grows from a larva into a pupa, and then finally into an adult flea.
So you've got this adult flea hopping around looking for a meal, but it's secretly carrying this tiny immature tapeworm inside it. And then the final step, I guess, is the pet.
That's the moment of truth.
Yeah.
Your pet, just grooming itself, maybe scratching the itch, or just doing its normal cleaning routines, accidentally swallows an infected adult flea.
An unwelcome, crunchy snack.
Exactly what it is. Once that infected flea gets into your pet's digestive system, the cysticercoid inside it is released in the intestine. It finds a nice spot, attaches to the intestinal wall, and bam, quickly grows into a mature adult tapeworm.
And the cycle starts all over again.
Completing the cycle, ready to start shedding new segments.
That is genuinely eye-opening. I think most of us, we just associate fleas with itching and skin problems, right? Not as this direct highway for internal parasites.
It's a common disconnect.
So the bottom line here for preventing dipilitium seems crystal clear then, doesn't it?
It absolutely is. This whole kind of complicated life cycle points to one critical, undeniable implication. Effective, consistent flea prevention is absolutely paramount for stopping the spread of Dipilitium caninum. Full stop.
Right.
If you break that chain, if you get rid of the fleas on your pet and in their environment, you effectively cut off the tapeworm's only ride into your pet.
It really highlights the connection.
It really underscores just how interconnected external parasite control is with internal parasite prevention. Many people might think of them as separate issues, but with Dipilitium, they're basically one and the same battle.
That's a really powerful takeaway. But you mentioned other types of tapeworms earlier, like Tallinia and Echinococcus. Do they also rely on fleas?
No, they don't. And this is where knowing the different types is helpful. While the flea connection is absolutely key for Dipilitium, these other tapeworm species are acquired differently.
How so?
These are typically picked up by, let's say, more adventurous pets, especially those with a strong prey drive.
The hunters in the family.
Exactly. If they hunt and eat infected rodents, like mice or rats or rabbits, or even if they scavenge on dead animals they find.
Ah, okay.
So while you're diligently fighting the flea battle, you might also want to, gently discourage those midnight squirrel snacks or enthusiastic rat-catching expeditions.
Good advice for our little adventurers. Okay, so we know what they look like, we know how they get in. Now, the really critical part. How do we know if our pets actually have these uninvited guests? Because I imagine many pets are pretty good at being silent roommates, at least initially.
You're spot on with that. Many healthy adult pets, especially if it's just a light infestation early on, might not show many obvious symptoms at all.
Sneaky.
Very. Which is why knowing the subtle and sometimes the not so subtle signs is just so crucial for us as owners.
Okay, so what should we as vigilant pet parents be looking out for? What's the sort of definitive evidence?
Well, the classic really can't miss sign is seeing the actual tapeworm segments, those proglottids we mentioned.
Rice grains.
Exactly. You'll typically see them as small, white, maybe slightly yellowish, flat rice-like segments, and they might actually be wiggling around your pet's anus, or maybe in their fresh poop, or sometimes even stuck to the fur back there, or on their bedding where they've just fallen off. Think of them as little moving grains of rice. Definitely not the kind you want anywhere near your pet.
Ugh, yeah, that's certainly a vivid image. Okay, besides seeing those segments, what about behavioral changes? Anything we might notice?
Definitely. Beyond the visual evidence, you might notice your pet doing what we sometimes affectionately call the butt scoot boogie.
The scooting, yes.
They might start scooting their bottom along the carpet or the grass, or maybe excessively licking and biting at their rear end.
Because it's itchy.
Exactly. It's not some new dance craze. It's irritation caused by those wriggly segments hanging around their sensitive areas. And sometimes, though it's less common, it can be more dramatic. Your pet might vomit, and you could actually see segments or even whole worms in the vomit.
Oh, wow. Okay.
Yeah, definitely a gross party favor that absolutely no one asked for.
Truly an unwelcome surprise. So if an infestation goes on for a while, maybe unnoticed, are there other signs? More systemic ones?
Yes, absolutely. If an infestation goes untreated for a longer period, or if it's particularly heavy, your pet might actually start losing weight.
Even if they're eating normally?
Yeah, even if their appetite seems fine. The tapeworms are basically silent nutritional thieves. They're hijacking vital nutrients directly from your pet's gut before your pet can absorb them.
Stealing their lunch money.
Kind of, leading to unexplained weight loss despite a good appetite. And while it's less common, in really heavy infestations, especially in vulnerable pets like young puppies or kittens, or maybe older or immunocompromised animals,
Okay.
you could potentially see issues like poor growth, maybe a dull coat, sometimes anemia, or in very rare severe cases, even intestinal blockages caused by a large mass of worms.
That sounds serious. So the take home is, if we spot any of these signs, especially those little rice-like segments, what's our immediate next step?
Without any hesitation, it's time to call your veterinarian. Make that appointment.
Right away.
Absolutely. These signs, particularly things like unexplained weight loss or that persistent irritation, could potentially indicate other health issues too. So getting a professional diagnosis from your vet is always the most responsible and safest step. They're the best detective for this kind of mystery.
Agreed. Okay, so you've made that call. Your vet suspects tapeworms. How do they actually confirm the diagnosis? I heard somewhere that the usual fecal tests don't always catch them. Is that right?
You've picked up on a very important point there. Yeah, unlike some other intestinal parasites where we expect to see eggs pretty readily under a microscope in a routine fecal flotation test,
Right.
tapeworm eggs are actually rarely seen that way. The proglottids release eggs, but they often don't float well or are passed intermittently.
So how do they diagnose it then?
The primary method is usually quite straightforward. Your vet will typically find those distinctive tapeworm segments, either in a fresh poop sample you bring in, or sometimes just by observing them directly around your pet's anus during the exam. Often, you, the owner, are the first one to spot them at home and report it.
Ah, okay. So it's really about that visual confirmation of the segments themselves.
Largely, yes.
And once it's confirmed, what's the treatment look like? Is it a difficult or complicated process?
Well, here's the really good news. Once diagnosed, treatment is highly effective. It's generally a very straightforward process. We have excellent medications nowadays specifically designed to target tapeworms.
That's a relief.
Definitely. The two main active ingredients we typically rely on are praziquantel and epsoprantal.
Praziquantel and epsoprantal. Okay, how do those actually work their magic? Do they, kill the worm and then, it comes out whole?
That's a common thought, but actually no, it's a bit different. These medications work by causing neuromuscular paralysis in the tapeworm.
Paralysis?
Yeah. Essentially, the worm loses its ability to control its muscles, including the ones it uses to grip onto the intestinal wall.
So it lets go.
It lets go, and then, rather remarkably, it just dissolves right there in the intestine due to the digestive enzyme.
It dissolves. Really?
Yeah, so you won't typically see whole worms or even obvious segments passing out in the poop after treatment. It's more of a poof, like they were never there kind of situation, which I think is probably a relief for most pet owners.
Definitely a relief. That's incredible. They just dissolve. Can you tell us a bit more about the specific medications you mentioned? Praziquantel.
Sure. Praziquantel is a real all-rounder, you could say.
Yeah.
It's effective against not just the common Diploidium candidum, but also the Tinninia species we talked about,
Yeah.
even Echinococcus species. So it covers a good range.
Versatile.
Very. And it's also available in various forms. There are pills, injections, and even some topical spot-on treatments that contain it, often combined with flea prevention.
Okay. And the other one, epsoprantal.
Epsoprantal is another excellent option. It's super effective for Diploidium candidum and also certain Tinninia species. The main difference is that it's only available in an oral form, as tablets.
Gotcha. Are they safe?
Both medications are generally considered very safe and effective when used as directed, with minimal side effects reported. However, it is worth a quick mention. There have been some rare emerging reports globally of possible resistance developing in tapeworms to these drugs.
Oh, really? Resistance?
It's very uncommon currently, but it just makes that diligent, consistent flea control even more critically important. It really underscores why prevention is the best long-term strategy.
That's a really important caveat. And it circles us right back to prevention, doesn't it? Because like we always say, the best offense is a good defense. Prevention is absolutely paramount. We really want to keep these party crashers out in the first place.
Absolutely. Could not agree more. When it comes to preventing tapeworms, especially that flea-transmitted Diploidium candidum, the single most critical message I can possibly impart is to prioritize consistent, effective flea control for all pets in your household.
All of them, even the indoor cat.
Yes, all of them. I truly cannot overstate this. If you just remember that fleas are the primary transporters for Diploidium, then it becomes crystal clear. No fleas, no ride for the tapeworms.
Makes sense.
This means using veterinarian-recommended flea prevention products regularly, year-round in many climates, even if you don't actively see fleas on your pets. Those infestations can build up silently.
Okay, so flea control is number 1, 2, and 3. What else can we do? How do we create this fortress of prevention?
Good question. Beyond vigilant flea control, maintaining a clean home environment is also really vital. Routinely wash your pet's bedding, any favorite toys, blankets. Use hot water if possible.
Hot water wash. Okay.
Regularly vacuum floors, carpets, and furniture where flea larvae might hide. And clean hard surfaces with appropriate disinfectants. Even a simple dilute bleach solution used safely, of course on hard floors, can help eliminate lingering eggs or larvae in the environment.
Right, tackle the environment too.
And your yard plays a role as well. Becoming a bit of a yard work warrior can make a significant difference.
How so?
Keep your grass cut short. Remove piles of leaf litter and brush where fleas like to hang out. And crucially, clean up pet poop daily from the yard.
Get rid of the segments quickly.
Exactly. This reduces potential flea habitats and stops environmental contamination by removing those egg-filled proglottids before flea larvae can get to them. You're basically making your yard as inhospitable as possible to those tiny, gross hitchhikers.
Makes sense.
And as we touched on earlier, for those pets with a taste for the wild, try to prevent them from hunting and eating rodents, rabbits, or scavenging dead animals, as these can be intermediate hosts for other tapeworm species, like Tecenia.
Okay, discourage the hunting. And what about us? Basic hygiene.
Absolutely critical. Always wash your hands thoroughly with soap and water after handling pets, especially after cleaning up any messes like poop or vomit, and always before eating.
Just good practice all around.
Exactly. It's good hygiene for everyone in the household, pets included.
Okay. Now, the question that's probably on a lot of listeners' minds, what about the human connection? Should we be worried about catching tapeworms from our pets?
That's a natural and really important concern to address. The short answer is generally, don't panic, but be prudent. For the most common one, Dipylidium caninum.
The flea one.
Right, the flea one. Human infection is actually quite rare. It typically only happens if a person, and it's most often a young child, accidentally swallows an infected flea.
Swallows a flea? How?
Usually through very close interaction with a heavily flea-infested pet. Maybe playing on the floor where fleas are active, getting fleas on their hands, and then inadvertently putting their hands in their mouth before washing.
Okay, so it's uncommon, but possible.
It's uncommon, yes. But it really underscores again why effective flea control on the pet and in the home is important for everyone's health, not just the pets.
But you mentioned other species earlier, like Echinococcus. Are the risks different there?
Yes, they are, and it's important to be aware of this. While Dipylidium risk to humans is low, certain species like Echinococcus granulosus or Echinococcus multilocularis are more concerning.
How so?
The eggs of Echinococcus species, which can be shed in the feces of infected dogs or wild canids, are immediately infectious to humans if ingested. They can cause very serious, slow-growing cysts, called hydatid cysts, in organs like the liver and lungs.
Wow, okay, that sounds much more serious.
It is. So, particularly in areas where these parasites are known to exist, meticulous hand hygiene after handling dogs, especially their feces, or potentially contaminated soil, is critical. Similarly, taken any species tapeworm eggs from pets could also, albeit rarely, infect humans if ingested, usually through fecal contamination.
So the risks definitely vary, but it sounds like there are pretty universal steps we can take to stay safe, regardless of the specific worm.
Exactly right. To reassure everyone listening, consistent, regular deworming of your pets, as recommended by your vet, diligent year-round flea control, and maintaining excellent personal hygiene, especially that thorough hand washing after handling pets or cleaning up, and before eating these steps significantly reduce any potential risks across the board. It really all comes back to being informed and proactive in your pet care and hygiene.
Okay, so there you have it. Our deep dive today has, I think, really shown that while tapeworms in our pets are pretty common, the good news is they are incredibly treatable and, maybe most importantly, highly preventable.
That's the key message.
By understanding their sometimes surprising life cycle, especially that crucial flea connection, we talk so much about recognizing the signs, even the subtle ones, and just staying rigorously on top of flea control and proper hygiene. You really can empower yourself to keep your furry friends happy, healthy, and tapeworm-free. And remember, if you ever suspect your pet might have tapeworms, don't wait, don't guess, don't hesitate. Consult your veterinarian straight away for a proper diagnosis and the best treatment plan for your specific pet.
What's truly insightful here, I think, is seeing how these seemingly disconnected elements, like a tiny flea, your pet's own grooming habits, maybe even how often you mow your lawn, all weave together to influence your pet's internal health. It's quite an interconnected system.
It really is.
And this understanding, it sort of raises an interesting question for you, our listener, to ponder. Beyond just tapeworms, what other subtle indicators or, invisible cycles might be quietly at play, influencing the well-being of those we care for pets? Maybe even people just waiting there for us to observe, connect the dots, and understand.
That is a truly thought-provoking question to mull over. Lots to think about there. For now, stay informed, stay vigilant, and let's keep those pets parasite-free.